Do you know how important your kidneys are and what happens when they fail? In the grand orchestra of our bodies, the kidneys play a vital role. These bean-shaped maestros conduct a symphony of processes to keep us healthy. Nestled on either side of our spine, kidneys are the unsung heroes of homeostasis, working quietly and tirelessly to maintain balance in our bodies. Our kidneys are like a highly sophisticated waste management system. They filter out waste products and extra fluid from our bloodstream, a task they perform around the clock, every single day. The smallest functional units of the kidneys, the nephrons, are the stars of this show. Each of our kidneys houses about 1 million nephrons, each containing a tiny filter called a glomerulus. These glomeruli are surrounded by a network of tiny blood vessels or capillaries, and it's through these that small molecules, waste and fluid pass. Now, when our kidneys are functioning smoothly, they filter out these waste products and excess fluid, turning them into urine that we excrete. But what happens when this system encounters a hiccup? What if our kidneys can't filter out waste effectively? Well, this can lead to dangerous levels of toxins building up in our blood, a situation that's as alarming as it sounds. This condition, known as acute kidney failure, can develop rapidly, often in individuals who are already hospitalized or critically ill. Its symptoms can vary widely and can sometimes be subtle, making it a tricky condition to diagnose. However, immediate medical attention is necessary to prevent severe complications. Our kidneys are vital players in our body's health, performing functions that go beyond waste management. They also play a crucial role in maintaining blood pressure, balancing electrolytes, and producing red blood cells. They are, in essence, multitasking marvels that keep our bodies running smoothly. Now imagine if this crucial organ fails. What would happen? What causes the kidneys to fail, and are there different types of kidney failure? These are the questions that we often find ourselves grappling with. The kidneys, as we know, are the body's master chemists, filtering waste and extra fluid from the blood. But sometimes, they falter. Various diseases, conditions, and even lifestyle factors can contribute to kidney failure. Let's delve deeper into this. Imagine a condition where the kidneys can't filter waste, leading to dangerous levels of toxins in the blood. This is known as acute kidney failure. It develops rapidly, often catching us off guard. It's most common in individuals who are hospitalized or critically ill. Picture a scenario where a person is recovering from a major surgery or a severe infection. Their body is already in a vulnerable state. Now add the strain of waste accumulation in the blood. That's acute kidney failure for you. A silent saboteur, it can strike when the body is already grappling with other health challenges. However, kidney failure isn't always a sudden ambush. Sometimes, it's a slow, stealthy enemy that creeps up on you over time. This is known as chronic kidney failure. Unlike its acute counterpart, chronic kidney failure is a long-term condition. It's often the result of years of gradual damage to the kidneys. The causes of chronic kidney failure can be diverse. It could be due to high blood pressure, diabetes, or even long-term use of certain medications. The common thread that binds these causes together is their slow and persistent nature. They don't cause immediate damage, but rather wear down the kidneys over time. So, kidney failure can occur rapidly or over time, and numerous factors could trigger it. But how would you know if your kidneys are failing? How does one identify kidney failure? What symptoms should you be on the lookout for? Well, the signs can be as varied as the individuals experiencing them, but there are some common symptoms that are important to note. Firstly, you might notice a change in your urinary habits. This could mean you're urinating less often, or that the urine is darker than usual. You might also experience swelling in your legs, ankles, and feet. This is because failing kidneys can't remove extra fluid, leading to edema or fluid retention. Next, there's fatigue and weakness. Your kidneys produce a hormone called erythropoietin, which helps make red blood cells that carry oxygen. In kidney failure, lower levels of this hormone can lead to anemia, causing you to feel tired and weak. Shortness of breath is another symptom to watch for. This can be caused by two factors. First, extra fluid in the body can build up in the lungs. Second, anemia can leave your body oxygen-starved and short of breath. Additionally, you might experience a persistent feeling of nausea or a loss of appetite. This is because a buildup of toxins in the blood can make you feel sick to your stomach. Unexplained weight loss might accompany these symptoms. Further symptoms could include sleep problems, decreased mental sharpness, and muscle twitches or cramps. These are often the result of imbalances in the blood that affect nerve and muscle function. Lastly, chest pain or pressure may occur if inflammation around the heart, known as pericarditis, develops due to the buildup of waste in the blood. Remember, these symptoms can be subtle and easy to dismiss as other, less serious issues. But they could also indicate a serious condition. Kidney failure is no laughing matter and can develop rapidly, especially in those who are already hospitalized or critically ill. The key takeaway here is that if you experience any of these symptoms, don't dismiss them. Seek medical help immediately. It's better to be safe than sorry, and early detection could make all the difference in treatment and recovery. Remember, these symptoms could indicate a serious condition. If you experience any of them, seek medical help immediately. If your kidneys fail, what can be done? What are the treatment options available? Let's dive into this crucial topic. Kidney failure, as we've learned, can be a daunting diagnosis. But the good news is, we have several treatment options at our disposal, generally falling into two categories: dialysis and kidney transplants. First up, dialysis. This is a procedure that artificially does what healthy kidneys would do: rid your body of waste and unwanted water. Dialysis comes in two types: hemodialysis and peritoneal dialysis. Hemodialysis involves circulating blood out of the body through a machine that filters out toxins before returning it back to the body. This is typically done 3 times a week in a dialysis center. On the other hand, peritoneal dialysis uses the lining of your abdomen, or the peritoneal membrane, to filter your blood. This can be done at home, and it's a more continuous process. Then, there's the kidney transplant. This involves surgically replacing the failed kidney with a healthy one from a donor. The new kidney can come from a living or deceased donor. A successful transplant can provide a better quality of life than dialysis, with fewer dietary and lifestyle restrictions. However, it's not without risks, and not everyone is a suitable candidate for transplant. The decision between dialysis and a kidney transplant isn't an easy one. It depends on several factors, such as the individual's overall health, the availability of a suitable donor, and personal preference. It's a decision that must be made in close consultation with healthcare professionals. Remember, these treatments are not cures. They're life-sustaining measures, helping to manage the condition and maintain the best possible quality of life. They can be challenging, requiring significant lifestyle adjustments and medical monitoring. While these treatments can be life-saving, prevention is always the best strategy. So let's talk about how to keep our kidneys healthy in the next segment. Stay tuned. Scene script. How can you protect your kidneys and prevent kidney failure? Well, the first step is understanding that our kidneys are like unsung heroes, working tirelessly to filter waste and extra fluid from our blood. These small but mighty organs are pretty remarkable, and we need to treat them with the respect they deserve. So, how do we go about maintaining kidney health? First and foremost, hydration is key. Drinking plenty of water helps your kidneys clear sodium, urea, and toxins from your body. But remember, moderation is the name of the game. Overhydration can also cause issues, so aim for a healthy balance. Next up, let's talk about diet. Consuming a balanced diet that's low in sodium and high in fresh fruits, vegetables, whole grains, and lean proteins can help reduce the risk of kidney damage. Keep processed foods to a minimum, as they often contain high levels of sodium and phosphorus, which can be tough on your kidneys. Physical activity is another crucial component. Regular exercise not only keeps your body in shape, but it also helps regulate blood pressure and lower the risk of chronic kidney disease. Whether it's a brisk walk, a bike ride, or a yoga session, find an activity that you enjoy and make it a part of your everyday routine. Regular checkups are also essential for maintaining kidney health. Routine blood and urine tests can help detect any early signs of kidney disease, enabling you to take proactive steps to manage the condition before it progresses. And lastly, if you have diabetes, high blood pressure, or a family history of kidney disease, it's even more critical to have regular checkups. These conditions can increase the risk of kidney disease, but with careful management and early detection, the progression of the disease can often be slowed down. Remember, your kidneys are vital organs. Take good care of them and they'll take good care of you.